Good evening, everyone. It's been a minute since I've been live, but I tell you, we're live and in living color with some beautiful guests to welcome back Dr. Keith Newby. So I'm going to bring some girlfriends in. Of course, I would be remiss if I didn't start with co-host Tamika. What you doing, girlfriend?
Right now, I am on Facebook Live monitoring girlfriend. So I will be reading your comments, and I see we already have some folks joining. So I would like to greet Miss Girlfriend Katrina Hurd Taylor. So good to see you, and the rest of the girlfriends join in. I will monitor your questions, comments, and we'll share them with Dr. Newby.
Well, I can tell them already that we're not going to finish this tonight. So we are going to be back with Dr. Newby. But before we bring him in, we've got to have the girlfriends come in first. Come on in the room, Busy. Come on in the room, Pam with us. And Chastity, come on in the room. And we're going to bring our honored guest, Dr. Keith Newby. Welcome back.
Thank you. I appreciate it. Glad to be here.
Always it's been a couple years. That's right. It's been a couple years.
I tell you, I'm amazing how fast time flies.
Yes, sir.
It's okay. Well, we're all here. Good Lord brought us together, so we're going to enjoy it.
Yeah, we're going to enjoy it. But, we would be remiss if the girlfriends didn't welcome you to Girlfriends Tea, because that's what we do. So what do, girls? We toast them. So welcome to Girlfriends Tea. Thank you for joining us, Dr. Newby, for a cup of tea. I know the girlfriends want to greet you before I start the interview. So go ahead, ladies.
Yes. Hello, Dr. Newby. I hear you on the radio, and I'm just like, that is a tell it like it is passionate doctor. And so for me to be in your presence this evening, it's a blessing. And I appreciate everything that you're doing in the community, and welcome.
Thank you. I appreciate those kind comments.
Good evening, Dr. Newby,
and welcome,
Girlfriends Tea. I'm really looking forward to this interview. I'm sure it's going to be informative, and I'm going to learn something. I have my notebook ready.
All right. Well, we're going to have some fun while we're learning.
Yeah. Okay.
Go ahead, Busy. Busy, can you unmute?
Good evening, Dr. Newby.
How are you?
All right, I'm fine. Glad to see you.
You as well.
Well, all righty. Let's get right into it. The girlfriends will come back. A couple of them have questions for you, Dr. Newby. So Mika is manning the floor and be able to flash any comments. And if you have a question and we can get to it, then that's what we're going to do. I'll ask Tamika to go through a couple questions. So Dr. Newby, there's a lot to say, and I won't get it all done. But I want everyone to know, in case you didn't see my Facebook post, the reason I asked Dr. Newby here is because I had a mini stroke. And it was 3 weeks ago today when I ran into him. Well, 3 weeks ago when it happened. But that weekend I ran into you and your lovely wife, Peggy. And I'll introduce you formally in a minute. And I was there with Pam, who's in the studio with us here. And you said, I told you, I said, Dr. Newby, I had a mini stroke. And you said, what are you doing here? It's like, he was like, what are you doing here? You should be home. And then I said to him, I'm sitting down. It's the same thing I would do at home. And then he just burst out laughing.
Yeah,
but
I'm not going to say another word on that one.
Well, they said I could come. They said I could just go. I said, all I'm going to do is sit down. But you know what? I want everyone to know who missed the first interview with Dr. Newby that I know Dr. Keith Newby because he was the cardiologist, the doctor for both my stepfather and my mom. And that's how I know of him. And I am just, I am thrilled to have connected with you, because when I connect with you, I really reconnect with my mom and my stepfather, because I know that you all used to joke a lot in the office, and I know they loved you a lot.
And I appreciate that. Everything I find in this business is about trust and relationships, and that means so much to me as I've developed my career, is how do I best really take care of people. You have to gain trust, because then when you're trying to advise people, they will listen to what you have to say. If the trust is not there, the likelihood you building that bond is going to be small. And then you can't really achieve those goals which you want to achieve, which is to give people their best life.
Absolutely. Absolutely. But I'm going to tell everybody, because everybody may not know you, or if they do, they don't know you formally. So you're a native of Norfolk, where you attended Maury High School. I went to Booker T, so everybody can't do the right thing. Everybody can't go the right way.
We all got bused back then. So
yeah. I think we were rivals. Weren't we rivals?
Mm-hmm.
Yeah, I think we were.
Yeah.
But you graduated from Norfolk State University, so behold the green and gold.
There you go.
Where you majored in biology and minored in music. Now, I found that interesting.
Yeah. Well, I was actually, when I started, I was actually a music major when I first started over there. And I don't know if you remember the old Norfolk Community Hospital.
Yes.
I volunteered there one summer. And it was after my first year of college. And, and I debated about wanting to be a doctor. My father was a physician, and he died at a very young age. And I kind of really, at that time, I wasn't sure how committed I was to medicine. So I volunteered at Norfolk Community one summer after my first year of college. And I just fell in love with it. And it just kind of hit me with like a ton of bricks. I said, this is what I want to do. So I changed my major to biology, but I kept the minor in music because music is still a passion of mine. And I've always been a passion of mine. Probably why I can listen to heart sounds so good, because I know rhythms, and that was always helped me with when I really got into cardiology. I could tell different heart sounds because of the rhythmic nature. So that actually helped me be a better doctor. So, but that's how I really got into it.
Well, when you brought up Norfolk Community, you brought back memories, because I remember my mother was there and I walked over there. So that is some history there. But of course, you ended up earning your medical degree from Eastern Virginia Medical School, and you opened your practice, cardiology and arrhythmia consultants in Norfolk in 1999.
Yep. Just to kind of capitalize, I went to after medical school, you have to get training. So I went to Emory University in Atlanta, Georgia, and did my internal medicine training there. Then I went to Duke University for my cardiology training. And then I came back to the area. Now I have an emphasis in electrophysiology, which is the study of heart rhythms. So I spent an extra year at Duke so I could really become expert at that. So then after that, that's when I came back here and opened up the practice.
Absolutely. And then you're president now and CEO of Fort Norfolk Medical Associates since 2010.
Yes.
Congratulations on that. 2010, that's a long time. That's a long time.
Yeah, that's okay. Listen, good Lord woke me up and wakes me up every morning. So I take that and roll with it. So each day is a blessing to me.
Absolutely. I want to give a shout out to your beautiful wife, Peggy, who I saw her again at Project Inclusion. And I saw you in the back of the room, but you had left. So yes, she's a beautiful person. And I also want to let everyone know that you're currently the medical director of Health Equity for Sentara Health Systems, where your primary role is to aid in the development of programs that address conditions that disproportionately affect under-resourced and underrepresented communities. So tell us something about that briefly.
Well, essentially, when that came into play, it started with the vaccine issue. Sentara approached me after that because they knew I was really instrumental in getting a vaccine clinic in my office started, and they know I'm a big community advocate. So they approached me and asked me what I helped them with developing programs. And it really essentially chronic medical conditions impact lives in African-American communities. The risk of high blood pressure, strokes, heart attacks, diabetes, all those things interplay. So trying to better educate our community as to how to live that best life, taking these things into consideration, were things that really are not being addressed adequately, in my opinion. And that's part of my role, is to help do that.
Outstanding. Well, I want to tell everyone why we're here, especially tonight. And we're going to continue this, so everyone will come back to you next month per his schedule. But I had a mini stroke, and I'm going to talk briefly about it. I just left a wonderful event. That's how it happens sometimes, right, Dr. Newby? You're just going along and there's no forewarning. And I'm telling y'all, I say a vision. People think it's a vision far away, but it was in my eye to me. And it was the weirdest thing. And I described it to the doctors, but all I can say is it was enough to scare me. I had blurred vision. I had just gotten on the interstate from the ocean front. And God would give us innate knowledge. I know nothing. I promise you, I know nothing about the body. I didn't know what was going on. All I knew was that I had this vision in both eyes, and I kept blinking, trying to get rid of it. And I'm gonna be honest, but it's funny. I pulled off these fake eyelashes because I thought it was the glue. I said, "Oh my God, the glue is messing with me." I couldn't believe it. So I pulled off the eyelashes. They were on a napkin on the side, and then I kept blinking, and it wouldn't go away. Something told me to close each eye to see which eye it was. And that's when I freaked out, because when I closed the left eye and then I closed the right eye, I saw both. I saw the image in both eyes.
Okay.
And I said to myself, Sebrina, it's your brain. I just said that. Sebrina, it's your brain. And I started calling 911, didn't get them. I didn't get them. So I started calling friends because I thought I didn't know what was going on. I just knew it was something with my brain. So I called several friends, but I ended up getting Pam, who's in the studio. And I said to her, listen, her husband is a retired physician, Dr. Ray Champ, formerly Dr. Ray Champ. And so they said, what's going on? And I told them I was going to patient first, Dr. Newby. But he said, based upon what you've described, I think you could be having a stroke. And that's when I really spazzed out. So I knew that time was an issue. So that's why I kept driving. And praise God, I got there. And as you know, the story is I had a CAT scan, MRI. But when we have, I hope I'm saying this right, ischemic. Am I ischemic? Is that right? Ischemic.
Ischemic. That's ISCHEMIC. Ischemic.
And when we have an ischemic attack or mini stroke, tell us why that can't be picked up. I don't know if you know why, but just educate us that it can't be picked up by the CAT scan or the MRI.
Well, look at when they say TIA or transient ischemic attack, that what by definition, what that means is you have a loss of blood flow to a part of the brain for a specific amount of time. So what typically happens is most of these are embolic or clot driven. So you'll have a small embolus or a clot that can affect the brain, but if it dissolves away faster than it actually caused damage, then you may not see it on the MRI. So, and there are some, technology issues, or I should say technical issues, where sometimes strokes cannot be seen on MRIs. Because remember, MRI is essentially a digital image of the brain. So in the processing of that image, there may be some dropout on certain things that otherwise would be needed to say a person had a stroke. So just understand that TIAs are typically oftentimes not visible on testing because of the nature of how fast the clot arrives and then dissipates off. And that's why they call it transient. It's not lasting. Now, the issues comes that if you have transient ischemic attacks left untreated, meaning if whatever the underlying problem, and we need to get into that, it could be leading to that transient ischemic attack. If not being addressed, the potential that you could have a stroke, a true stroke, is high, left unmanaged. So a lot of people will have an event, think, oh, it's no big deal, and they go about their way. Then they have a massive stroke later on. So the fact that you really addressed it early is kudos to you, because there are a lot of people, especially in our community, that will blow things off, and next you know they have major issues that you can't reverse.
Well, Dr. Newby, one thing I don't care for is pain. I'm gonna be honest with you. I'm a big baby when it comes to that. I mean, I'm like a chihuahua. I'll bark you down till I realize you're bigger than me. But I know you're bigger than me. I'll be like, hey, I was just playing. So, when I went there, I told them, and they didn't think I had one because I passed the peripheral.
Yeah.
I passed that. And so I actually didn't get the CAT scan and MRI that night. I'm going to be honest. When I left, and I got there, it was about 10 o'clock at night, or when I got there at 8, and it was 10:30. And I had on heels and a dress. I'm just keeping it real. And I said, look, I'd like to go home and get comfortable and come back. So they said, why don't you just go to, patient first? I don't want to tell too much because they were good. And Anyway, I ended up going the next day. He thought I had a detached retina. Mm-hmm. That's how I got to my eye doctor.
Okay.
She's awesome. She would never say I'm her patient, but, because, she's just like you. They don't say it, but I'm calling her out because she's awesome. Dr. Stephanie Marino. Okay. So she checked me out. She's fabulous. And she said, I don't think, she said, no, she didn't say she didn't think. I know you didn't have you don't have a detached retina, I think you have had an TIA, right? Transient ischemic attack. So, and then I went to the hospital and they basically, did the workup. But here's the question I want to ask. I have so many. Okay, so they did the CAT scan and the internist came to me and said, it looks good. You look good, especially for your age, it looks good. But then I said, well, I did know this. I said, most people say that stress causes strokes. And she said that's a major misconception of stress being the primary cause of strokes. It's genetics first. And someone in my family has had a stroke. And it's also age related. But then I asked her, which you just already explained, why did I see those images? And she said, when you lose oxygen, your brain plays tricks on you and shows you things that aren't there.
Well, the one thing, I would say this. I think genetics is clearly a factor. Age is clearly a factor. But to be honest with you, in my opinion, a stroke is a form of heart disease. Anything and really the definition of heart disease is anything that affects the heart or the great vessels. The great vessels include your aorta, the cerebral arteries, and the vertebral arteries that go to the brain. The aorta goes into the abdomen, kidneys, and liver, and your leg arteries. So anything that affects any of those items is a form of heart disease. Now, when you talk about what are those causes of heart disease, which includes causes of stroke, if you look at the true causes, you'll see there's a strong correlation, more so with hypertension, diabetes, high cholesterol levels. There is a genetic predisposition, so family history does play a factor. Cigarette smoking, those are, and of course, obesity. If you're overweight, that is always going to be a factor. So if you look at brass taxes, those other items I just described, that's going to be more of a factor than just age itself and genetics by itself. Now, the issue on genetics is going to be, if, say, like an example, you have somebody who had a heart attack, and I know we'll talk about that later, but if they had, say I had a father that had one at age 40. So if he had a heart attack less than age 55, that suggests there's a genetic predisposition. So under that circumstance, you want to say, okay, yeah, that's a potential genetic cause because the geneticism can lead to some of these other issues. But what you'll find more so than not is the other stuff involved. Like you get somebody, and this is the problem in our community is a lot of people have hypertension, they have diabetes, and they ignore it. Or they say, well, I feel fine. They never go to a doctor. They never get lab work. They don't do any of these things. And what happens is your pressures are high. You don't know it, or you have it, but you say, oh, well, that's no big deal. Hence, the stroke can occur. So what I have found is more those other issues. And that's why you see such a high prevalence in our community. African Americans are going to have a higher incidence of these medical conditions, oftentimes because of the incidence of these other medical problems that we have, and they go unnoticed and unchecked, and then you start having things like strokes.
I want to make sure I educate because I had never heard of Be Fast. I mean, all I know is this sharp pain in the chest. Trust me, I went to the ER so many times thinking I had a heart attack, and they're like, "Girl, bye. You're just stressed. Whatever." But better safe than sorry. But Be Fast. B, the letter B, E, F-A-S-T. So balance, eyes, face, arms, speech, and time. So elaborate on that for us.
Well, essentially, anytime you think about if you have ischemia to the brain, what is it going to affect? What are the things that the brain controls? Now the issue becomes that is kind of an acronym to try to give you a kind of an understanding of the possibilities so that you recognize it quickly and address it quickly. Because everything, and when you have ischemia, and ischemia means that there's low blood flow to an area. The way your body gets oxygen is through your red blood cells. So you have to have, and look at it almost like if you have a train, look at a train like your red blood cells, and people like oxygen molecules. So what you have to have, the way this stuff has to work is train pulls in the station, doors open, people get on board. So that's what happens in the lungs. You take a breath in, or like people coming to a train station. Your red blood cells are like boxcars. So the doors open and people get on and it takes off. It's going to go somewhere and deliver those people somewhere. So you have to have a certain amount of these oxygen molecules to every part of your body in order for that body part to function. So when you have brain cells that are damaged because of lack of oxygenated blood, those areas are going to become affected. So when you talk about vision, how you think, your balance issues, how your muscles work, everything has to get signals from your brain to allow you to do levels of activity, be it walking, talking. So like if your speech gets slurred, or your face droops, or something, your vision goes out. All these things the brain has to work in order for those functions to occur. So that acronym is kind of a global kind of overview to say, if you notice something like this, then you need to get to the hospital fast, because the quicker they can reestablish blood flow, the more likely you will recover. If you wait too long and that area has been compromised, the blood flow too long, then a lot of times damage will become permanent. And that's when you start having those disabilities that we don't want to have.
I want to, because for me, I didn't even realize until really Girlfriend's Tea that heart disease is the number one killer in American women. I had no idea. So just to keep things sober, I have some stroke facts. Nearly 800,000 people in the United States have a stroke every year, with about 3 or 4 being first-time stroke sufferers. Someone in the U.S. has a stroke every 40 seconds, and every 4 minutes someone dies of a stroke. 87% of strokes of which you're talking about are classified as ischemic, as you just mentioned. So at what point, and then we're going to talk about heart attack and heart disease, at what point should your neurologist get involved? They want me to go to a neurologist because they couldn't find anything, and I welcome all of that. And I'm going to wear a heart monitor. I welcome all of that. But at what point should a neurologist get involved?
Well, I think if there's a question, if somebody is having an acute event, where you have, like, say, your arm's not working or your vision goes out, then a neurologist should be involved immediately, because the faster they're involved, then they can say, yes, we need to reestablish blood flow. So they can make the diagnosis quickly. That's their area, just like heart attacks for us. So the quicker they're involved, the less likelihood strokes will continue and go on to cause more problems. So I would always involve them quickly in this setting of an acute event. Now, say such as yourself, where you had the event and it went away. That's a blessing that it went away. I wouldn't necessarily involve a neurologist immediately, because most doctors, especially people have a little bit of extra expertise, as do I, because we know what the causes of strokes can be. So we should be able to quickly identify, what's your blood pressure? Do you have a heart rhythm issue? And the reason they talk to you about wearing that heart monitor is when you look at causes of strokes, in addition to those things I mentioned earlier with the blood pressure and the diabetes, heart rhythm disturbances, particularly atrial fibrillation and atrial flutter, which are top chamber rhythm problems. If somebody is having that and they don't know it, and a lot of times that can be the case, the top chamber of your heart is not expelling blood completely when in the face of atrial fibrillation. If somebody's in it longer than a day, then the potential that clots start to develop in that top chamber are present. Then when the heart goes back into normal rhythm and the heart starts beating like it's supposed to, it could break those clots loose and they could go up to the brain. So identifying if somebody has atrial fibrillation is going to be important, because you treat that differently. A person like that has to be on blood thinners, true blood thinners, immediately to try to prevent further strokes from happening. So to answer the question about the neurologist, I would say in the face of an acute event that you're having, it needs to be immediate. If you have transient events, you have to just make sure you get to a doctor, and preferably a primary care doctor or cardiologist, who can identify your risks and make sure those risks are being identified and addressed. Then I think that will put the person in a much better position to try to prevent further complications.
Okay, before I go on, we're going to go transfer to, we're going to talk about heart disease. Tamika, you want to go ahead and read that question from Erica? I can bring you in or you can come in. There you are. You're on mute, dear.
I actually have two questions. So the first question is going to be from Lisa Smith. And her question is, can sleep apnea increase your risk of having heart disease?
Definitely. And the reason that is the case, for those who don't know what sleep apnea is, that is a condition, and I find sleep apnea like a ton in patients, but that's a condition when people intermittently stop breathing at night when they sleep. Some of the signs of that are excessive fatigue, interrupted sleep. So they wake up a lot during the night, and people will sometimes say, well, I'm just getting up going to the bathroom. But if they snore heavy, they may have sleep apnea. The reason why that's a problem, you know, we talked earlier about the importance of oxygen getting to the brain. When people have sleep apnea, especially depending on the severity of sleep apnea, a lot of times when they sleep, they stop breathing. That means they're not transmitting oxygen. So your oxygen levels drop. If they drop too low, which they can do, that the heart doesn't like that. You know, and what can happen, they can have atrial fibrillation as a result of that, but they also can have a higher incidence of high blood pressure. They have a higher incidence of stroke because when you're not breathing, your blood likes to clot in the face of hypoxia or low oxygen levels. So the risk for heart disease goes up tremendously. I've seen people with sleep apnea develop heart failure, where the heart becomes damaged and they start getting weak. So there's a strong correlation of all that with sleep apnea. So to answer the question, yes, clearly, and throughout all the literature, you will see a correlation of sleep apnea and the formation of heart disease.
Wow, that is phenomenal info. So, should folks, just to follow on with that question, should folks be tested for sleep apnea if they're snoring, or how would you know you have sleep apnea?
Well, a lot of times, you know, you'll find it used to be once upon a time we thought that sleep apnea was mostly in the obese and overweight patient base because you see people with thick necks, and they were oftentimes where they get obstructive sleep apnea, tongue falls back when they sleep at night. But I have some rail thin patients with severe sleep apnea. So that just the being overweight, that puts you at higher risk, but it doesn't say that's the end all be all. So what I do oftentimes is I listen to the history, and this is why our position is important because, you know, again, it goes back to what Sebrina mentioned earlier about, you know, can you have like a TIA and not show up on the MRI? We think about prior to technology. And I came in an era where we didn't have, I mean, I did, well, I should tell them my age if I say this, but we didn't have cell phones when I started medicine. We did not have, I mean, I remember the first Mac I remember was when I think I was in residency, you know, so computers weren't the big thing then. You know, we had to use clinical judgment. And I still say to this day, the problem with technology is sometimes we become too dependent upon it, and then we lose that skill set we had before. A good history in physical. And when I say that, meaning that you take a good history, you talk to the patient, finding out what's going on, what are the nuances of their particular condition, you know, the social history aspects that unfortunately, so now I don't see people do as much now. What happens is you lose track of some of that clinical judgment skill. So, you know, for me, the history and physical is like the premier thing that helps drive me to know what to do. So if I have somebody, I'm looking for the signs of sleep apnea. I look at them. If I got a patient falling asleep in front of me, you know, when we're talking, I know there's a high likelihood they may have that. And it could be just narcolepsy, but there's a high incidence when I talk to patients to find out their energy levels, if they're really tired all the time, if they wake up just as tired as they went to bed the night before, if they have started to have memory lapses, if they have blood pressure problems. And I find out from family members that they are a heavy snorer, I'm going to send them for a sleep study. I look for things like on ultrasounds on their heart, if the heart's thicker than it should be. Because what happens when you when you deprive the heart of oxygen, it starts because it's trying to get that oxygen. So it starts working in overdrive. And what can happen is the heart can start to thicken over time. So I'm looking at all these different factors, putting them together, and I come up with that conclusion and say they need to be tested. I don't want people to think just because you snore, because a lot of people that snore don't have sleep apnea, but a lot that snore do. But that's for us to help you know that you need to be tested or you don't need to be tested. So it's really a clinical judgment call.
Wow, that's really good info. Thank you so much. I do have one last question, and this is from
Okay.
Miss Katrina Hurd Taylor, and she is asking, what is the difference between I'm not going to say it right, ischemic and hemorrhagic stroke?
So what ischemic means, you're deprive the blood, the heart or brain or heart, whatever, of oxygenated blood. So in other words, say if you have a blockage in a vessel, that's called ischemic stroke because you're depriving that area of the body of oxygenated blood. Hemorrhagic stroke is when you actually have a bleed. So say somebody had an aneurysm, or sometimes we get a subarachnoid hemorrhage where the vessel would burst and they bleed into the brain. That's going to cause similar symptoms, but I can't say the problem with hemorrhagic strokes is they could be really devastating because you have to stop the bleeding. And if it's an arterial bleed, I mean, that means you have to operate on that person quickly. Ischemic strokes we can deal with a little bit better because we have tools to remove clot. But when somebody's bleeding, that's a whole different ball game. And when you have somebody with major high blood pressure, that's what sometimes you'll see hemorrhagic strokes. So the difference is just how the brain is compromised. Is it compromised because of lack of oxygenated blood or too much oxygenated blood because you're actually bleeding in the brain? So that's the difference between the two.
Thank you so much. I'll turn it back over to you, host Sebrina Brown.
Thank you so much, Mika. I tell you, this is rich, and I'm glad that everyone is able to ask you some questions because that's what we're here for, to get educated and get some knowledge. So we're going to go to heart disease. Okay. What are the top diseases of the heart? My mother, she had congestive heart failure, and I know she had to change her diet, but just tell us what are some of the top diseases of the heart.
Okay, so I like to I'm a big analogy person. I think sometimes people understand disease better when you can share with them ideas of things they deal with every day. So I look at the heart like a house. I use that analogy a lot. So if you think about your house, you have your foundation, floor, ceiling, walls, you have rooms, you have doors that open up and close that allow you to go from room to room. You have plumbing, and you have electrical circuits. So look at your heart similarly. Each room in your heart is called a chamber. Each door in your heart is called a heart valve. So that valves have to open and close and allow blood to flow from one part of the heart to the next. Your coronary arteries that line the surface of your heart are like your water pipes in your house. And then you have your electrical circuits where you flip on the light switch, you expect the lights to cut on. So when you think about what are the things that can affect it, so you affect your foundation, then you're talking about an unsturdy house. So you can develop something called heart failure if the function does not work like it should. So if the heart's either weak or stiff or whatever, and it backs blood into the lung, you can have what we call heart failure, and that's called congestive heart failure. There are different types. There's either the heart is weak and it just cannot pump blood places, or it becomes stiff, like we see in people who have high blood pressure and other things, where the heart tends to get thickened and grow over time. And when the heart's trying to pump blood and it has to expand, because the heart has to fill with blood, expand, and contract. If the expansion is stiff, pressure builds up and backs it to the lungs. So it's either one, you get fluid that gets into the lungs and can cause shortness of breath. So that's heart failure. So then you have coronary disease, which could cause heart attacks. And that's like if you have a blocked water pipe. So you think about, you cut on a faucet, you expect water to come out. You cut it on full force, you expect the water to come out full force. If you have a partial blockage, you cut on that water, then it's coming out, but it's not coming out completely. If you have a complete blockage versus a partial blockage, you pull on that faucet, nothing comes out. That's like a heart attack. So that means nothing is getting to that specific area of the heart. You have multiple vessels that supply different parts of the heart. So you can have a heart attack in one vessel, but the other vessels are doing fine. But when you hear people having sudden death after a heart attack, that means that what happened is that part of the heart was compromised with blood, and that led to a heart rhythm issue. So, and it could be a dangerous heart rhythm issue like ventricular tachycardia or ventricular fibrillation, which are dangerous heart rhythms in the bottom chamber of the heart. So you could have heart rhythm issues like atrial fibrillation, ventricular tachycardia, those dangerous rhythms, or you can have the coronary disease that we talked about earlier, or you can have structural problems, which would be like heart failure. And then finally, you talk about heart valves. So you think about the door. If the door won't open right or won't close right, if you're trying to get in the door, say like if you're coming from the outside, you want to be able to open the door, come in your house, and close the door. Now, if it's like hurricane outside, you wouldn't be able to close that door. So you
Right.
think about it, that door won't close and you have a hurricane going on, then you're going to get swept out or swept back because of flow coming back of air. That's like a regurgitant valve. So a heart valve that won't close right, blood likes to flow, it's trying to flow one direction in the heart. But if it can't close and go to the next room, it's going to flow back as well as flowing forward. So you have blood that mishes in the heart and it kind of mixes up, and that can get overwhelming to the heart and cause heart failure like symptoms as well. So if you have a valve that won't open well, that means you're trying to get through the door, but you can't get through it. So you imagine blood's trying to get through, can't really get through like it's supposed to. That can cause symptoms as well. So that's kind of I guess the number of or different types of heart diseases that you can have.
That explains why. I mean, when I was in the hospital, my mom, there were so many different doctors. And even when they thought I had heart issues over a decade ago, 2 decades ago, there's so many different doctors. I'm like, it doesn't take all that. But I see now that it does because there's specialists in each area.
Yes. So that's so it's really the identification is always going to be the first key. That's why that history and physical is so important. I mean, testing should just confirm what you already know. A good doctor is going to be able to tell, for the most part, what's going on just on his history and physical. The testing is supposed to confirm, not take the place of your history and physical. So it's supposed to confirm that which you already are suspicious of. So in my mind, what I do is when I'm taking my history and physical, I'm working through in my mind, somebody says I'm short of breath. I have to think about, okay, is this a heart issue, a lung issue? Is it or other, such as anemia or some other kind of possibility why somebody may be short of breath? So I have to, in my mind, okay, I have to talk to them. I'm asking questions directing me down a certain path. Like if I'm worried about a heart issue, well, tell me, how does your shortness of breath occur? Is it when you're walking or you're at rest? When does it happen? Is it when you're laying down? Because that can help identify as a heart issue. Now, if they tell me they're wheezing, they're a smoker for 20 years and whatever, I may say, okay, this may be a lung issue. So I have to ask questions that give me down a path, and then I will order a test to help confirm that which I'm already pretty sure they have, because that confirmation helps me to decide then the best treatment for that individual. So when we're trying to really work through that dynamic, that's why I tell people, don't be Dr. Google, because you don't know what you're looking up, and I know a lot of people do it. But the problem with that is if you don't understand medicine, you may take yourself down a path of worrying about something that's not there, or you misinterpret some information because the internet is not a regulated place. I can put anything on the internet I want to, and I have nothing to back it up. So you have to be careful of the sources you're using when you go on the internet, because if you're just like look up one thing, you may look at information that's inaccurate. So that's why don't bypass your doctor. Make sure you now, I'm not saying don't look things up, but you have to be careful when you look it up, what you're reading and what you're interpreting, and don't let that be your guide. You want to look for other possibilities, and you want to seek your guidance from professionals that can really help guide you to what's the best way to treat your particular condition.
Well, we have loads of questions coming in. Thank you for that, by the way. Interview, because I have a couple more questions, and I know we have two guests in the interview. But I mentioned that my mom had congestive heart failure, so we do have a question from Tamika's mom, Cheryl Ward Kirkland, and she wants to know what causes fluid to build up around the heart.
Well, one of the things that I want to try to get people away from, and that's a term that's kind of not really accurate when they say build up around the heart. By definition, fluid that builds up around the heart would be as the sac the heart sits in, which is called a pericardial effusion. But that's a term, those terms are used loosely. Really what's happening is the heart's trying to push blood forward. The heart has to pump blood in a big circuit to take arterial blood flow out of the heart to all your organs or down to your feet. And the venous blood, when all the oxygen is sucked out of the red blood cells, your venous blood, which is darker, has to be pumped back to the heart. So that heart has to be strong enough to pump the blood into a big circuit, and then it goes right around again. So if the heart is weak, think of it as trying to pump a certain amount of blood out, but it cannot do that because it's too weak to do that. So blood can be coming to the heart, but then more blood is coming back from the last circuit, and it can't get out because of, the heart's just not strong enough to pump all that blood out. And then it backs up into the lungs. And when it backs up to the lungs, it causes fluid to kind of expel there because the lungs are getting congested with fluid. So really, the proper term is in heart failure is that the heart is unable to keep up with the demands of the body, and it backs up into the lungs, and then it gets leaked out through the blood vessels into the lungs and causes what we call pulmonary edema. And that's really what's happening in heart failure. So it's not really around the heart. That's called a pericardial effusion. But heart failure is when the blood's backing up into the lungs and it's leaking out into the tissue. So that's kind of really, when you hear that term, that's really what heart failure means. So when we talk about people that get really short of breath, and I'm cautious with that term because, say, like example, you've been sitting, on your duff for 2 years, like during COVID, nobody did anything. And then also you go out and try to run a marathon, you're going to get short of breath, not because you have heart failure, because you ain't done anything in 2 years. So, you have to be careful. That's where we come in, is to help really guide you to say, is your shortness of breath coming from the fact that you have heart disease, or is it another reason? Say, as an example, you gained 50 pounds during the pandemic. You go out and walk, you're going to get short of breath because you gained that 50 pounds and you had not used to carrying that extra weight around. So it just depends on the condition that helps to define whether somebody has shortness of breath that's coming from a heart condition or not.
Well, listening to you, I think one of the tickets for those who care, and not everybody in this interview cares, everybody watching cares. We just need to understand our bodies and how it works so that if we knew all of this is why doctors probably know not to eat certain things, because you see the horrors of it. We don't have to know everything, but we shouldn't wait until we have a problem, is what I'm conveying. Yeah. To understand what we're doing, how it impacts our bodies, which brings me to the major contributing factors. I know I'm going to bring in Chastity. Chastity Pritchett is the first African-American to have her own olive oil company. And we know the benefits of olive oil. But what are some of the major contributing factors to heart disease? Is it diet? I mean, I know it could be hereditary, but I'll let you answer.
Well, I think that the diet plays a factor, not directly, but indirectly. There is some direct correlation, but the indirect correlation is a poor diet leads to hypertension. A poor diet leads to diabetes. A poor diet leads to high cholesterol levels and obesity. Then that leads to heart disease. So what you find is that the other stuff, the things that are caused as a result of that poor diet, lack of activity, you say people that never exercise and they just sit on their laurels and they just eat all day and they're eating the wrong foods, that can lead to heart disease. And that's more, I think, in my personal opinion, that's more the culprit problem, is what you eat that causes the other issues that lead to heart problems. So that to me is like so that is like, a big deal. Now, stress, you mentioned stress earlier. Stress can cause heart attacks. It can cause strokes. Now, there's not, the correlation of that is more indescript. I mean, we do have data that says that can occur. But what happens, again, secondary causes. If you have high stress levels, you can increase blood clots, which can lead to stuff. So all these factors, lifestyle, I don't know if you ever heard the term social determinants of health. Yes. That is where you have other factors that lead to chronic medical conditions. So like, say as an example, somebody was food insecure or they were house insecure. Housing insecurity is defined by saying that your 30% of your income is going towards your house. That means you have very little money to put everywhere else. So that means when you have to make your food choices, what are you picking? You're going to pick the cheapest thing, which is typically the worst thing, unfortunately. So your choices impact your heart. If you're stressed out because you're trying to live in check to check, your job's not really what you would like to be, you're not making the kind of money, or you live above your means, then what happens is the stress of that lifestyle and the choices you make can lead to heart problems. So that, by definition, 80% of people with social determinants is what causes the chronic medical conditions. Only 20%, by definition, are truly from chronic medical conditions by itself. It's the lifestyle we lead, which is why in our community and our people are affected more because of these other issues that impact our lives.
That's why I'm glad that the focus is on health equity,
Yeah.
considering the lifestyle, because you may not be familiar with the lifestyle of that community. It's not intentional, but you have to become familiar, I guess, right? And then the disproportionate analysis. So I'm going to bring in Chastity. Welcome, Chastity Pritchett.
Hi, this has just been a great conversation. So my mind is just going, but let me get down to what I wanted to initially say. As Sebrina stated, I'm the owner of a extra virgin and infused olive oil company. And I started Emblem because I saw that there was no representation of Black people in the olive oil industry. And with African Americans, as you mentioned, especially females having the highest rate of heart disease, but olive oil can prevent and reverse heart disease in females, in all Americans. And so what I do is I teach people how to cook with olive oil. I put them on a 12-week program, and they have chronic illness when they come to me. And in the fourth day of them eating right, the Mediterranean diet, and cooking all their foods in olive oil, that fourth day, most of my participants are lowered in their high blood pressure is lower. People have come off of insulin and all of this. So I know that you said that it starts with the food, but I'm seeing that a lot of the people that come to me, they have no direction. The doctor may say you're borderline, diabetic. Like, okay, but what do I go from here? What do I go from there? So I'm seeing that people don't have direction, and that's what I really want to. That's what I'm more passionate about than selling a bottle of olive oil. Educating people, giving them the tools that they need on what to cook in the kitchen, what vegetables, what's an eggplant, an avocado, and all of these things that people just don't know about. So thank you so much. I'm encouraged myself. I want to continue. I've been a vegan for over 10 years now. I want to go today, right now, and go exercise, even though I do exercise, but after this I need to exercise some more. So thank you so much, and I hope that we can possibly maybe do some things together. I don't know, in the future, but thank you so much, Dr. Newby. And thank you, Sebrina, for having me on as well.
Oh, you're so very welcome. So very welcome. So I'm going to bring on Pam. Pam, are you ready to come in? I'm adding you to the stream. There you are. Pam. Okay, she must have
Hi
frozen.
there.
There you are. There you are. Okay.
Ooh.
Okay, my question is, what role does the thyroid, does that play any part? Like in my case, I have hypothyroidism. Is that,
It
how
can.
does that play into heart design?
It can. The thyroid gland is part of the endocrine system, and it does regulate temperature in certain aspects of the body. So what I've seen in patients who are hypothyroid, meaning their thyroid is very underactive. Now, everything in medicine is about degrees. You can have a little bit, you can have a modest amount, or you can have a lot. Usually hypothyroidism, when the thyroid is underactive at high levels of underactivity, can lead to pericardial effusions. I've seen that before, bradycardia, where the heart rate is slow. And I do see that now. You don't see so much a correlation of that in coronary disease or heart failure as much as you will see those other things I described. But that's easily treatable with medication. If you're hyperthyroid, meaning your thyroid gland is overactive, I have seen people become tachycardic and have atrial fibrillation as a result of hyperthyroidism. And that can lead to some forms of heart problems, typically just as a direct result of the high heart rates. So yes and no. It definitely could cause certain forms of heart disease. Typically has to be profound, one end or the other. But again, if you're hypothyroid and your energy level's low, you ain't gonna want to exercise much because you're gonna be too tired to do that, which can then lead to other things. So there are indirect and direct correlations.
Okay. All right. Thank you.
Uh,
Awesome. Awesome sauce.
one
So,
comment, yeah, one comment I want to make about the olive oil thing.
okay.
I think if you look at, she was right on point as it relates to that the diet, the things you choose when you're looking at Mediterranean diet. That's actually the most heart healthy. So that and olive oil is a big part of that. So if you look at it's not the olive oil it by itself, it's the olive oil with the lifestyle change that she recommended. So I think when you talk about how do we best help each other is through partnerships, like she mentioned. You want to create these partnerships of people working together to give individuals their best health. So I think her points were right on, with that lifestyle change. I think those are the things you really want to focus on. Unfortunately, so we do still want to go to Joe's Crab Shack. We want to go to McDonald's and Wendy's and all these other places because it's fast. But the problem is the type of even the oil they use. But it's just an unhealthy way to live your life. And she was absolutely on point. So kudos to you.
Outstanding. So before we go, what are the signs? And we're going to continue this. I'm going to see if I can get you back in 2 weeks, but we'll see. What are the signs? If not, it'll be next month. So we have to go through Mama Peggy for that. But what are the major contributing factors for heart disease?
So if you look at when you talk about risk factors, when we look at what are the conditions that we mentioned before: obesity, hypertension, diabetes, high cholesterol levels, smokers, geneticism, inactivity. If you don't exercise a lot, you have that. Those are all independent risk factors for heart disease. And when I say independent, meaning if you just have hypertension, you're at risk. If you just are overweight, you're at risk. If you're just even inactive, you're at risk by itself. Now, you put all those things in combination, though, of course, then your risk goes up and up and up. And that is the biggest problem, I think, in medicine that we have is trying to convince, especially our community. Oh, I'm going to tell you, the headaches I got to go through sometimes, get people to listen. And I don't doubt, and everybody's on this call, I want to make sure everybody's clear. I don't doubt when people say, I know my body and this, I get, I got people, I just saw somebody today, this pressure is 170. They live at that level. And I'm fighting with them to convince them that we need to get your pressure down. And then when I'm telling her that, I said, that blood pressure can cause heart attack. She said, well, I've had one of those. I said, yeah, I know. That's why I'm talking to you. I said, and this can cause strokes. Yeah, I've had that too. Yeah, I know. That's why I'm talking to you. And it could cause heart failure. Yeah, I got that too. Yeah, that's why I'm talking to you. I'm trying to help you to live by getting this pressure control. And she is so worried to say she can't take medicine because it makes her sick. And they correlate, and we have a trust issue with medicine, just like with the vaccine, medicines. And I'm not saying all medicine is good, but when you weighing it all out, what high blood pressure can do versus maybe if you have a side effect from the medication. But the question is, in the end, is that medication doing the job that's going to help get you better? I don't want you to feel bad being on medicine, but if we're going to sit there and just ignore it and we're going to live our life in a way that is going to be not beneficial, that's the part that breaks my heart. Because I love people and I love my people. And when I'm fighting, trying to keep you alive and you're steady fighting me, and I know that the outcome, what it's going to be, because I live it every day. I'm hoping that I can convince everybody on this call. I'm not saying I want you to feel bad with medicine, but try not to label medicine too quickly. And again, a lot of times if you change the lifestyle, you can get better. I got patients who aren't on medicine, but they had to change their lifestyle around, but trying to get people to do it. They still want to eat at McDonald's and not take medicine. They still want to gain 50 pounds and not take medicine. And I'm like, but you can't do, you can't do both. It's going to be one's fighting the other. So, I'm saying this to say, I want to see you live. I want to see you live. I want to see you thrive. But you can't just write things off so quickly and then you get yourself in trouble. Because if you look at life expectancy of African Americans versus whites, there's almost a 10-year difference between the two groups. Why is that? Because we fight our docs and we don't do the things that we're asked to do. And then we live shorter. And I don't want to see that anymore. So that's why I do what I do with you. That's why I do what I do in the community, because I want to see our people live and live their best life. And my sermon's over. I'm sorry.
No, you're absolutely fine.
You just don't want to see that people hurt themselves. And I see it too often.
You're absolutely fine. I mean, now that I've experienced what I've experienced, I am moved, to keep this before me along with everything else that I do. So this has become a passion for me. So I've already partnered with you. I'm just going to be partnering with you more. And I want to say this because when you came on in 2021, I was a man one was not going. I was not going to get that COVID shot, no matter what you said. You know it. He was trying to convince me, y'all, but he called me out on Girlfriend's Tea because I was talking about the COVID vaccine. He said, "You need to get your vaccine." And you know what? I came because of that. But I also came because I watched my own pastors go, because Bishop Macbeth and Lady Janine. When I saw them go get it, and then my girlfriends went and got it, I thought, well, I don't want to be left behind. If I get COVID, I'm going to leave the earth. So that's why I did it. So I thank you.
Well, the thing is, even with that, and I'll be brief with this statement. When the COVID vaccine first came out, I mean, I'm seeing people dying left and right of COVID-19. I mean, that was the only disease that made me nervous. HIV, when in the early 90s, I was in Atlanta, and that was like HIV capital of the world then. And, and I was seeing people, I mean, all kinds of stuff. And back then, there was only one drug to treat HIV with. That didn't that didn't make me nervous being around patients with HIV. We didn't know a lot about it then, but it didn't make me nervous about it because I knew how it was transmitted. But COVID was a whole different ball game. And people were getting that stuff and they were dying like left and right. When that vaccine came out, I saw a tremendous drop over like 3 or 4 months of hospitalizations, deaths with COVID. So I was convinced. I mean, to me, I'm not going to let my friend that don't know anything tell me not to do something and get me killed. And I'll tell you, just like even this thing, I saw something with Jamie Foxx and they put something in his shoe. I saw on there talking about he got a COVID vaccine and that's why he had a stroke, if that's what he really had. And I think that's irresponsible reporting because we don't know that that's what happened. And to me, I want to jack up that reporter that put that out there because I'm like, listen, Chief, I worked for 3 years to get people vaccinated. You gonna jack this up now over that, and you get an entertainer that people respect, and if that comes out like that, people are gonna say, I know I'm not gonna get it now.
Right.
And that is irresponsible reporting. And I'll tell you, I better not see that guy because I'm gonna get him. Because I have seen what the positive things for these vaccines can do. So I would just say to people, do not allow the media to drive your decisions on medical topics. They don't know anything. That's why they're reporters. They're reporting news, but they don't know medicine. So go to people you trust, professionals, not Joe Blow down the street that doesn't know anything, and make sure you get the proper information to make your best decision. I'm not saying everybody needs to do everything I say. I just want you to make sure you get the right information so that you can make the best decisions.
Excellent. I'm going to bring the girlfriends back in. And somebody said, that's right, trusted professionals. I want to let everyone know that we can't see your name when you comment unless you click on the link. So in this live, there's a StreamYard link that says, you give permission for StreamYard to show your name in case you want your name to show. So I'm going to bring in co-host Tamika, and I'm going to bring in the others once I get this banner out of the way so we can see them. Chastity and Pam. I know Busy had to leave before the last question with all the girlfriends on, and then we'll toast you. Why are women so prone to being killed by heart disease, Dr. Newby?
A lot of times because women get blown off, and that used to be something we saw a lot of. Meaning, when I say blown off, meaning you come to a doctor or emergency room, and people always say, "Well, there's no way you have a heart problem." The lifestyle that women lead now, because you see there's a lot of more obesity in women now than it was 20 years ago. So when women come to the emergency room, people will say, "Oh, I know you're not having a heart problem because you're a woman," and they get blown off, and hence they go home and die of a heart attack. So part of it is lifestyle. Obesity rates are higher, which means that the other illnesses that come as a result are higher, which leads to these heart issues. With men, the emergency rooms they're ready, because they're like saying, we know men have a high incidence of heart attack, so they come in with chest pain, they immediately get addressed. And the other thing is, women sometimes, I've heard, and I mean I hear this in real time, where their symptoms are different, and why we don't know. Meaning there's like a classic type kind of textbook way that people look at people who have heart disease. There, you come in, you have these symptoms, it feels like X, behaves like Y, but women don't always present in the textbook way. So then they get blown off in that right too. So what I personally do is let the history and physical dictate it. Look at what medical conditions they have. Do they have high blood pressure? Are they diabetic? What's the cholesterol levels? Things that I don't let just the story dictate me, but what is their relative risk? We have to do something called like a predetermined risk factor. We have to look, what is the likelihood of the pre-test probability that this person has heart disease? You have to look at all those factors, not just one. And then from there, you make an assessment. And that's where I think has not occurred with a lot of women. That pretest probability is not utilized. I think it is more now than it used to be, but that's why I think there was that difference.
Well, Dr. Newby, I'm going to be writing Lisa. We'll be seeing what we can do to get you back to continue this conversation, because it is significant. And having went through it and witnessed my mom go through it, I can only say to you that at 59 years old, and I'm 59 still now, when I went to the ER 3 weeks ago, I had never been in a hospital. And when they closed that curtain to give me some privacy, I cried, because I said, God, how did I end up here? How did I end up here? I'm relatively healthy. But I want to say this to encourage everyone, because my mom, as you know, was strong, and sometimes she didn't obey her diet. We all know this, regarding that. But it helped me to identify with her, because the one thing she did was she would just roll with it. She wasn't afraid. And so it encouraged me to just roll with it after I cried. It is what it is. All I can do is be better. That's all we can do.
But that's the key. And if we can believe that and be better, then living that best life becomes a reality.
Yeah.
Absolutely. Well, what are we going to do, girlfriends? We're going to toast Dr. Newby. Well, as before, we can't call you girlfriend because you're a guy, and we're not going to call you boyfriend because we respect Mama Peggy. So what do we say, girlfriends? We say guy friend, guy friend.
Thank you.
Guy friend, Dr. Newby.
I'll take it.
Yes, so very much. Thank you. We're going to embrace you back again. And may God just continue to bless you as you bless the community, because you're doing a lot.
Well, thank you. Well, this is what God, I've convinced this is my purpose in life. I have no doubts in my mind. This was the intent God wanted me to do, and I'm going to do it to the best of my ability. I'm going to continue to do it to the best of my ability.
And before I really close out, I know you were asking for volunteers during COVID. Do you still need volunteers at your office?
Always need volunteers. I think we have, if you go to our website, fortnorfolkmedical.com, I'm pretty sure we still have a volunteer form up there. But, I would say, either email me, and that's k.newby@fortnorfolkmedical.com, or go on the website and, kind of leave it. And you can go to Newby Foundation, which, is our kind of a not-profit arm that, I named after my father, who died at 41 of a primary heart tumor. So I would say start off the Newby Foundation, and see, and you go up there, or again, Fort Norfolk Medical, and see if you can kind of maybe donate a little bit of your time. My wife is big on nutrition. She goes to a lot of schools, and she's being big on these tower gardens, taking them. These are like self-contained units that we go and put into school systems to try to teach the young kids kind of how to eat properly. And you'd be surprised how much they get into that. And she's done an excellent job with that. So I tell you, that's my right hand right there.
Well, outstanding. So we've done our justice, and I will be following up. And I can't thank you enough. And I'm going to put that link on the page so people can know where to go volunteer, and we'll get you some volunteers.
Thank you. I appreciate it. And listen, I hope this was beneficial to everyone. I really pride myself on making sure I give you the right information in a way it can be understood. So please give me the thumbs up if you felt like I did a great job, because I want to make sure we do what is necessary to help you all.
You did a great job, and we'll see you back soon. Thank you so very much. God bless you, sir.
Same
You're
to you.
welcome. All right.
Bye.